Good afternoon, everyone. Thank you so much for joining us for the Future of Nursing 2020-2030 webinar on supporting nurses' well-being to advance health equity. I'm Sue Hassmiller, Senior Scholar in Residence and Advisor to the President at the National Academy of Medicine on Nursing. The Future of Nursing 2020-2030, Charting a Path to Achieve Health Equity report released in early May and is currently online. The report builds on progress nurses have made over the past decade. Since the last report on nursing, Leading Change, Advancing Health, we've strengthened education, advanced practice, promoted leadership, and increased workforce diversity. As the largest and most trusted segment of the healthcare workforce, nurses are well suited to help our country to advance health equity. We believe that. It's clear that nurses are more than capable and have the potential to build healthy communities for all. But nurses will need more support from the systems that educate, pay, and employ and enable them to do this critical work. The COVID-19 pandemic has underscored that nurses cannot care for others if they are not receiving adequate and appropriate care and supporting nurses' physical, emotional, and mental health at the systems level and at the individual level. We have a fantastic lineup of speakers today who will cover nurses' well-being and why this is so important for health equity and how to support nurses at every level. So you can see our fantastic lineup, and I'll ask them to go black and just show the first two speakers. And I'm really happy to announce, as I always am at the beginning of these webinars, that we have nearly 1,700 people registered. So we are very happy about that. Big numbers on all of our webinars. So let's get started, shall we? Our first two speakers will provide an overview of nurses' well-being and the connection to advancing health equity. Mr. Marcus Henderson, who served on our Future of Nursing 2020-2030 committee, is an adolescent services charge nurse at Fairmont Behavioral Health System and lecturer at the School of Nursing, University of Pennsylvania. And right after Marcus, we'll hear from Dr. Katie Boston Leary as the Director of Nursing Programs at the American Nurses Association. So Marcus, take it away.
Good afternoon, and thank you, Dr. Hassmiller. I'm grateful for the opportunity to speak with you all today and to have served as a member of the committee contributing to this vitally important work. The committee's vision for the future of nursing is the achievement of health equity in the United States built on strengthened nursing capacity and expertise. By leveraging these attributes, nursing will help to create and contribute comprehensively to equitable public health, social service, and healthcare systems that are designed to work for everyone and eliminate disparities. Next slide, please. The systems that educate, pay, employ, and enable nurses need to fully support nurses and foster nurse well-being so that we can in turn support the well-being of others. Promoting nurses' health and well-being is critical toward advancing our collective vision of health equity through nursing. The COVID-19 pandemic has starkly revealed responding to crises takes a serious toll on nurses' mental and physical health. Nurse well-being is impacted by physical, mental, moral, and social factors that originate from a range of sources from the individual to system level. However, nurses were experiencing a well-being crisis long before the pandemic, and here are some quick facts. Estimated rates of burnout among nurses range from 35 to 45%. Nurses are at a higher risk than the general population for suicide. Nurses that report poor physical and mental health are more likely to commit medical errors. Bullying and incivility still remains a major problem in nursing schools and in practice today, and can result in mental health issues, burnout, and high turnover. 1 in 4 nurses experience workplace violence at the hands of patients or their family members, leading to mental health issues and affecting well-being. And racism, discrimination, and harassment from employers, educators, managers, colleagues, and patients based on an individual's race, ethnicity, gender, disability, sexual orientation, gender identity, and gender expression have long been issues in the profession. This leads to emotional exhaustion, hardship, burnout, and the increased emotional labor and burden of an already emotionally demanding and stressful job. Confronting these issues can be uncomfortable and challenging, and nurses may not feel empowered to raise these concerns about these inequities because of fear of retaliation or compromised relationships. When the claims or voices of nurses are discounted and silenced, stress is heightened and well-being is negatively impacted. Poor nurse well-being can lead to poor patient outcomes, higher costs, and more nurses leaving their jobs or the profession entirely. The co-occurring pandemics of COVID-19 and racism have imposed new and evolving challenges for nurse well-being, but have also offered opportunities to give nurse well-being the attention it deserves and to address systems and policies that create workplace hazards and stressors. For nurses to take on many of the social determinants, nurses must first feel healthy, well, and supported. We are calling on nursing to assume a more prominent role in advancing health equity. And if we do not fully support nurses and foster nurse well-being, how are we to achieve health equity built on nursing strength and capacity and expertise? Next slide, please. Many professional organizations are also taking steps to promote nurse well-being. For example, the American Nurses Credentialing Center's Pathway to Excellence program recognizes healthcare organizations that demonstrate a culture that fosters a work environment that promotes well-being. Institutions that meet the 12 standards focusing on workplace excellence are seeing improved patient care, decreased emotional exhaustion, and higher job satisfaction. The American Nurses Foundation launched a national well-being initiative in collaboration with the American Psychiatric Nursing, the Emergency Nurses, American Association of Operating Room Nurses, and AACN for nurses to address the increased stress related to the COVID-19 pandemic. This initiative involves peer-to-peer conversations, cognitive processing techniques, and apps for stress reduction. The National Black Nurses Association has Reset, a mental health wellness program for Black nurses that includes counseling service and wellness podcasts and educational webinars. And the National Association of Hispanic Nurses conducts educational programming on stress and compassion fatigue. Next slide, please. The Future of Nursing Committee concluded the following about the state of nurses' health and well-being. All environments in which nurses work affect the health and well-being of the workforce. Ultimately, the health and well-being of nurses influences the quality, safety, and costs of care they provide, as well as organizations and systems of care. The COVID-19 crisis has highlighted the shortcomings of historical efforts to address nurses' health and well-being and has intensified nurses' stress and left nurses feeling unprotected and unsupported. The lack of sufficient data and evidence about the negative impacts of burnout, fatigue, and stressful work environments on nurses' health and well-being hinders our understanding of the severity of these issues and limits the ability to address them appropriately. Many programs and initiatives seek to improve nurses' health and well-being. However, the translation of effective evidence-based interventions into practice requires further research to understand the impact of these programs and initiatives and the relationship to system factors. Structural racism, cultural racism, and discrimination exist within nursing. Nurses of color experience racism, discrimination, and bias within the workplace and educational systems, compounded by the lack of diversity among the workforce and faculty. Nurses, educators, and leaders have a responsibility to address racism and discrimination within the profession, to build structures and systems that promote inclusivity and health equity. And finally, coordinated and collaborative action at the individual and systems level, encompassing nurses, educators, employers, and all relevant stakeholders, is needed to promote nurses' health and well-being. Improving the health and well-being of the workforce will require multi-level and multifaceted approaches to establish safe, supportive, and ethically grounded environments. Next slide, please. For nurses to help others be healthy and well, we must first be healthy and well ourselves. A lack of nurse well-being has consequences for us all, thus impacting our progress toward advancing health equity. The Future of Nursing Committee recommends that nursing education programs, employers, leaders, licensing boards, and organizations should implement structures, systems, and evidence-based interventions to promote nurses' health and well-being, especially as nurses take on new roles to advance health equity. Some examples of strategies to implement are for nursing education programs to integrate content on nurses' health and well-being into their programs, to raise awareness among students about the importance of understanding these concerns and develop the skills necessary as they transition to practice. Education programs can create mechanisms, including organizational policy and regulations, to protect students most at risk for behavioral health challenges, including those students who may be experiencing economic hardships or feel as though they are unsafe, isolated, or targets of bias, discrimination, or racism. Employers can also create similar mechanisms to protect nurses in the workplace from retaliation when advocating on behalf of themselves, their peers, and patients when reporting unsafe working conditions, bias, discrimination, and racism. Employers can establish a culture of physical and psychological safety and ethical practice in the workplace and create accountability for nurses' health and well-being. Ensuring nurses' well-being requires an investment in individual strategies within a systems approach that addresses the structures and policies responsible for the hazards and stressors that lead to poor health and well-being. This investment is analogous to that needed to address SDOH in our communities. It is not sufficient to ask people or nurses simply to make better choices when the systems and structures that surround us are designed to promote poor health and inequity. Approaches to supporting nurse well-being must be embedded systematically in every aspect of nursing and in every practice setting. Next slide, please. As we transition to our next speaker, Dr. Katie Boston Leary, who will provide you with a more detailed overview and data related to nurses' health and well-being from the American Nurses Association's extensive work during COVID-19 and with the Healthy Nurse, Healthy Nation initiative. The Healthy Nurse, Healthy Nation program is a program building a community to connect and engage individuals, nurses, and organizations to take action to improve health and well-being across the domains of activity, sleep, nutrition, quality of life, and safety. The goal of Healthy Nurse, Healthy Nation is to create a healthier nursing workforce, thus improving the health of our nation. Thank you. Dr. Boston Leary.
Thank you, Marcus.
Thank you. Thank you, Mr. Henderson. That was a great presentation, and there's a lot that you covered that I will cover in my presentation. So I will just serve to at least exemplify your points and share some of the data behind what you had to say. So thank you for that. Your final slide captured the American Nurses Association vision and pillars to build a healthy nation by building a healthy nursing population. So let's take a step back and review data and evidence that will undergird the urgency and importance to address nurses' health and wellness. Next slide, please. So we will start by understanding the current state of nurses' health. In 2018, the Bureau of Labor and Statistics indicated that nurses have some of the highest rates of non-fatal injuries and illnesses compared to other occupations. RNs have experienced some of the highest injury and illness rates in healthcare and social assistance sectors, with injuries in hospitals more than any other setting. That same report also indicated that nurses' health and wellness rated worse than the average American. Nurses tend to be overweight, have higher levels of stress, get less sleep, and suffer occupational hazards of occupational and workplace violence and physical injuries, mostly due to the demands of shift work. Next slide, please. The next slide provides more granular information on how nurses fare with 4 of our 5 pillars that you saw on Mr. Henderson's slide of health prior to and earlier this year during the pandemic. As you can see, there is not much difference, surprisingly, in health behaviors, which indicates that nurses were not in good shape prior to the pandemic and certainly during. This is very interesting data, as we expected far worse numbers during the pandemic. It does make you ponder how much of these shortcomings in the areas of nutrition, safety, sleep, and exercise are baked in or normalized. So let's break these numbers down. A BMI of 27 indicates that our nurses are 20% overweight. Under safety, workplace stress is the highest risk factor. 12% of nurses reported falling asleep while driving, which is very alarming. And only 45% of nurses engage in regular exercise. Next slide. We analyzed data on mental health from 9 surveys that we conducted of a total of 110,000 nurses during the pandemic. 85% of nurses reported feelings of exhaustion, with 65% reporting anxiety. The box in the corner provides a breakdown. Look at the number of nurses seeking mental health support. And the data on suicidal ideation is concerning as well. And by the way, 1% of nurses reporting suicidal ideation equals 42,000. Losing anyone or any nurse to suicide is unacceptable, and we must address that. Next slide, please. There is a lot of variability with how organizations are addressing nurses' health and wellness, with resiliency programs, EAPs, or some taking a head in the sand approach, hoping that all will be well when the pandemic blows over. The point here is that we need to constantly assess and measure the wellness of nurses and respond accordingly. These reports require immediate action, positive disruption, and innovation. Next slide, please. So why is the need for action urgent? Here is our breakdown of data, more data, regarding nurses' intent to leave the profession. Our Pulse of the Nation's Nurses survey conducted earlier this year indicated that 18% of nurses intended to leave the profession, with 21% undecided. As you can also see, the number one reason for nurses intending to leave the profession is the work is negatively impacting my health and wellness. Next slide, please. With health and well-being a concern for most nurses, one would hope that most of us would have sought mental health support. The data, unfortunately, suggests otherwise. 76% of nurses did not seek mental health support, with the top 2 reasons being not needing it and feeling that I can deal with it on my own. Of particular concern, BIPOC nurses, or nurses of color, were even less likely to seek support. Let me give you some numbers. 55% of Black nurses that responded to the survey most often noted that they did not need mental health support. 50% of Asian nurses felt that they were able to manage their stress on their own. There was the highest concern of stigma with family with seeking mental health support, with 11% of Pacific Islanders and Native Hawaiian nurses. But all in all, issues of stigma with colleagues and fear of retribution were consistent concerns across all races in terms of seeking mental health support. Next slide, please. Speaking of BIPOC nurses, or nurses of color, the ANA has partnered with multiple nursing associations across the country to form the Commission to address racism in nursing. This is a sampling of numerous stories and statements from a series of listening sessions of approximately 60 nurses. You see here themes of lack of opportunities, questioning of clinical skills, low expectations, harm, marginalization, submissiveness, and the need to code switch are all evidence here in these statements. These experiences occurred in the academic or school setting and have continued and carried over into the work environment. Next slide, please. This slide places a fine point on the fact that nurses of color fared worse in every category, from being exposed to COVID to financial fitness and impact. Black nurses fared worse in every category compared to other BIPOC nurses, and certainly compared to their white counterparts. Next slide, please. Overall, this further exposes a cultural issue. When programs are made available, nurses tend to not take advantage of these programs. Have we normalized suffering as part of our nursing culture? We must explore what lies beneath the surface and understand root causes. Is it the chicken or the egg? Is being a nurse hazardous to our health? Our entrance to the profession unhealthy to begin with, which worsens after entering the profession? Do the weathering experiences of BIPOC nurses or nurses of color contribute to their health behaviors? All these questions to Mr. Henderson's point, require research and attention. Next slide, please. In closing, the case has been made for nurses' health and wellness to be owned and addressed with tenacity and urgency. It is clear that a relatively small segment of the nursing population are nurses of color are faring worse than our white counterparts. We must do better with taking care of ourselves, each other, and address racism at the root, within the profession and in care delivery. The path to addressing health inequity starts with having a strong, healthy, and resilient workforce, but also runs through addressing the inequities that exist within the profession. The quote from Nandi et al. Really stresses the importance of addressing this issue and how structural racism and healthcare is a key influencer of health, and elimination should also align with the professional nursing policy priorities. And in order to effectively address health inequity and social determinants of health, nursing must first look inward to address inequity, lack of diversity, discrimination, and racism that lies within the profession. It is not hiding. It's always been in plain sight. Next slide. We do have many resources on our Healthy Nurse, Healthy Nation website and on the Wellbeing Initiative website that is free to anyone and everyone. You do not have to be a member. The Healthy Nurse, Healthy Nation website has a heat map survey that gives you comparison data to other nurses in the US. And we also offer challenges. The Wellbeing Initiative site also has a stress self-assessment, a nurse's guide to mental health support services, and a narrative expressive writing program for nurses to anonymously share thoughts and experiences with a guided writing program that is supported by trained professionals. Lastly, my ANA colleague, Dr. Pavico, who will be speaking later, leads our Pathway to Excellence program that offers a dedicated standard and framework for recovery and supporting nurses. Thank you for listening, and I will turn it back over to Dr. Hassmiller.
Well, all I can say is, wow. I love data, and thank you, Dr. Boston Leary and Mr. Henderson. I think we have a fantastic basis for the rest of our speakers who will talk about the systems level, and also the discussion that I really want to lead the group in at the end. So I also want to mention too at this time that we had a lot of people turning in questions to us ahead of time, ahead of this presentation, and I've kept track of those. And but I really want to encourage you as you're listening to these presentations to please put your questions in the chat function. We'll try to get to as many questions as we can. I will tell you that many of the questions so far that have come in are around strategies. Just tell me what to do, not only from a system level, but an individual level. So please send me those questions. And also what's resonating with you. So our next two speakers will be discussing the systems level approaches to address nurse well-being. Dr. Victoria Tiazzi, who also served on the Future of Nursing 2020-2030 committee, is the Director of Research Science and Informatics Strategy at the New York Presbyterian Hospital. She'll discuss how technology can negatively and positively affect nurses' well-being. Dr. Deborah Stamps is the Executive Vice President of Quality, Safety, and Innovation and Chief Diversity Officer and Inclusion Officer at Rochester Regional Health. She's also the President of the College of Health Careers at the Isabella Graham Hart School of Practical Nursing at Rochester Regional Health. And I might add a very important leader in our Future of Nursing campaign, New York State Action Coalition. So I thank Debbie for her work with those efforts as well. So with that, let's turn it over to Dr. Tiazzi.
Terrific. Thank you, Dr. Hassmiller. And good afternoon. So as mentioned, I had the pleasure of serving as a member on the Future of Nursing Committee, providing informatics expertise. So today I'd like to share with you the technological factors that impact nurses' well-being. Next slide, please. So for this report, the committee chose to examine well-being with a very broad lens, so encompassing many aspects of the nurse's physical, mental, social, and moral well-being. And in the well-being chapter, the report also references another National Academy of Science report called Taking Action Against Clinician Burnout. And in that report, it outlines 3 levels contributing to a decrease in clinician well-being. The first level is the external environment, which is really around the healthcare industry, laws, regulations, standards. The second level is healthcare organizations, which really encompasses leadership, management, structures of organizations. And the third level, or frontline care delivery, includes things connected to team interactions, the local organizational conditions, and technology in the workplace. So really connecting to that physical environment. So I'm going to focus on that third level specifically. So in the coming decade, we expect to see bigger technical advances in healthcare, such as connecting with patients in the community, using remote patient monitoring, providing more access to rural populations, and implementing innovative technologies to support nursing practice. However, these all must be considered and truly implemented, juxtapose the technological stress in the workplace related to the well-being of the nursing workforce. So one big stressor is the electronic health record and the increase in electronic data collection. While it can certainly be advantageous to have more data, we also need to ensure that it is not adding additional burden. Nurses spend a large portion of their day charting and also searching for hard-to-find data within the record. Research has indicated that this can negatively impact their morale, namely taking away from other activities such as spending time with patients and families. And for tasks that are clerical in nature, this may also prevent nurses from practicing at the top of their license and also creating a moral dilemma. So as we propose the inclusion of social determinants of health data in our electronic medical records, which is a very needed data source to address inequities, we really must consider a significant redesign of clinical documentation. And that's just not removing unnecessary documentation, but also streamlining ways to view patient data quickly and efficiently. Another technological source of workplace stress is the abundance of clinical alerts and alarms. Alarm fatigue can impact a nurse's well-being and moreover can lead to adverse events in patient care. So there is certainly an opportunity to generate more research in this area to understand the impact of inappropriate parameter settings in our devices and the effect of unneeded alarms on nurses' well-being. Next slide, please. On the flip side, we have fortunately seen some very promising interventions utilizing technology that have really come to light in this past year. In particular, mindfulness skills and practice have gained traction. There has been a steady increase in the emergence of several mental health focused apps that hold promise for reducing symptoms of mental illness, but also can help with managing symptoms of other chronic illnesses that nurses may be struggling with. So one example is the Happy app, which is for emotional needs, especially for nurses tackling anxiety and stress. It is a very easy to use smartphone app that connects nurses one-on-one to a support person 24/7. So you can talk to a compassionate listener. The first call is free for as long as you want to talk. So there are a number of resources like this, and Katie certainly alluded to the site where you can find more like this. So the proliferation of telehealth technology and telemedicine visits has also really benefited nurses that may need access to mental health providers wherever it's needed. So the hope is that over the next decade that these technological advances will continue to support nurses and their well-being. Next slide, please. As a path forward, there must be a real measured approach to not only leverage the promising interventions that I just mentioned, but also alleviate the stressors as we continue to investigate the effects of new data sources and the use of mobile health technologies on nurses' well-being. One way to do this is for nurse leaders to role model the use of mobile health apps for mental health and really create the space and the opportunity for nurses to participate in such activities during the workday. Next is collecting data to better understand the health and well-being of the nursing workforce, and especially as it relates to the use of mobile health apps. So this enhanced understanding should be used to inform the development of additional evidence-based interventions for mitigating burnout, fatigue, and turnover, and also to inform the design and development of new technologies to support nurses. And that's where we really need nurses at the table to participate in the design and the solutions that are most needed. And last but not least, the report's recommendations include ways to evaluate, strengthen, and advocate for policies, programs, and structures within organizations and licensing boards to support mental health treatment for nurses and make those structural changes that drive improvements. So when it comes to technology, for example, the burden of electronic documentation for nurses must be lifted by federal regulators, insurance companies, technology companies, and the like. One great example of work in this area is the Centers for Medicare and Medicaid Services Patients Over Paperwork initiative. Through coding and reporting reforms, this program is looking to streamline regulations that decrease cost and burden of documentation while also improving patient outcomes. So to conclude, for nurses to take on the many social determinants that influence health, nurses need to first feel healthy, well, and supported themselves. The judicious use of technology can alleviate burden, and with that careful design and input from nurses, can also advance well-being initiatives. Thank you, and I will turn it over to Dr. Stamps.
Thank you again, everyone, for this opportunity to share our systems strategies regarding nurse wellness. Nurses, including frontline nurses, nurse leaders, student nurses, and faculty, encounter physical, mental, and emotional challenges, and this leads to burnout. The COVID-19 pandemic highlighted these challenges, and in order for nurses to care for others, they must care for themselves, starting with being healthy and well. And this has been shared with my colleagues in their previous presentations today. Nurses not only being healthy can lead to the negative consequences for each other from a collaboration perspective, for our patients, for employers, for schools of nursing, and for the communities in which we serve. The pandemic also highlighted that we have not made progress in achieving health equity, and that nurses can take an active role in advancing health equity. And it's going to become more imperative that all of our stakeholders, including policyholders and makers, educators, employers, leaders, nurses, take a step to ensure that nurses have well-being. I will share with you our health system strategies, some of them, related to nurse, faculty, and student nurse health and wellness, leading to health equity. Just to tell you a little bit about Rochester Regional Health, we are a 9-hospital healthcare system in upstate New York. We are the largest healthcare system in upstate New York, where we care for close to 2 million patients across 14 counties. And we span over almost 3,000 square miles. Next slide, please. We're an integrated healthcare delivery system where we have close to 20,000 employees, just over 4,300 nurses. We have various specialties from ambulatory primary care. We see more than 200,000 emergency visits. And we have a College of Health Careers that has currently 2 programs, a practical nurse program that enrolls about 300 students a year, and a newly established associate in applied science program. Next slide. For Rochester Regional Health, health equity is really about eliminating disparities in health. This also includes social determinants of health. For us at Rochester Regional Health, health equity is not an appendix, an additional thing to do. The goal and the expectation is woven through everything that we do. We will also know that we will achieve health equity in our community when every person has the opportunity to attain his or her full health potential, that there's no one left behind, that there's no disadvantaged individual because of any social or social determinants of health. Next slide. Our strategy is looking at nurses. And when I speak of nurses here, I'm including nurses that are frontline and nurse leaders, as well as nurse faculty. And then I'm going to refer to students. So for nurses across our health system, and this is really a lot of the work is with our diversity, equity, inclusion team, as well as our Chief Nursing Officer Council. We have to start with recruitment. We have to attract and retain. And so we have to be intentional with our recruitment. We need to look at our data, which we did. We looked at the makeup of our staff and employees across, and we actually went a little deeper and looked at nurses, for instance. So we have to be intentional with our recruitment. We want to have a diverse talent pool and a pipeline, and we're going to talk about how we've done that with our student nurses. And most people want a work-life balance. So having a schedule that meets the needs of the individual nurses and being flexible, having some of those flexible opportunities. And then having opportunities for advancement, whether that is through a clinical ladder opportunity or career path from frontline nurse to nurse leader and so forth. We also have incorporated diversity, equity, inclusion, basic training and education, where we're rolling out across our health system foundational knowledge, starting with a standard vocabulary, unconscious bias, microaggressions, social determinants of health, and also looking at those social determinants of health and how they affect our employees and our nurses especially. We also have to have a diverse workforce that meets the needs of our communities. And so also understanding where that information, what the data looks like from a community perspective and ensuring that we have the workforce. And then we have to have the inclusion at our various systems and locations that support diversity and inclusion. Nurse retention. Our Chief Nursing Officer Council with various departments across our health system looked at the various items here. Compensation programs. Are we innovative enough? Are we competitive enough? We looked at flexible scheduling, weekend programs, and per diem programs. We looked at optimizing care delivery. This was mentioned earlier. And this is really taking feedback from the nurses to create that care delivery model. We also did this in the College of Health Careers with our 2 programs, actually getting feedback from the faculty on optimizing how we deliver our curriculum, how we deliver the programs. The electronic medical record optimization was just really spoken about, and we're actually in the process of doing that, led by nurses. And then again, other employee-driven solutions. When we think about health and wellness programs, that's the use of yoga, cooking demonstrations that can be fun and really focus on building the team. Office meditation, what can you do in your office or at your desk as far as meditating, taking that moment just for yourself. Deep breathing, exercises, practicing mindfulness. We have a series across our health system of mindfulness education and training that focuses on how to reduce burnout, some activities, actions, foundational education. And then pet therapy, aromatherapy are all proven strategies for reducing stress and improving health and wellness. And then having the wellness room, the living wall. How do we provide a safe space that you can just go and sit and relax and get in touch with yourself? These strategies will lead to workforce equity, where we will be able to not only recruit, but also retain a diverse workforce. As far as students, it's about access to the programs. So we have programs in place to help some students prepare for entry into a nursing program. We also educate diversity, equity, and inclusion throughout the program. There's core curriculum in the beginning of the programs, and then it is transitioned throughout, where it ends with actually a community project that they complete and present. We also look at the social determinants of health of our students. We know that they're on the journey from increasing their education, but do they have trauma that they have to manage? Do they have food insecurities? And then ensuring that we have the resources for those wraparound services so that they can be successful and be retained in the programs. We also look at behavioral health. We have a large behavioral health network in our health system, so we have an advantage for crisis intervention and ongoing support for our students, along with the financial. We do have student-focused town halls that help students be able to bring their concerns forth also. And again, the wellness opportunities are very similar to what we offer for our nurses in the workplace. This all really leads to equity, health equity. If we can identify and mitigate those social determinants of health, if we can continue to make it a more inclusive work environment, we will have health equity that leads to those outcomes for our patients that we're all looking for, from an improvement in health and elimination of those healthcare disparities. Next slide. This is an example of some of the activities that our Chief Nursing Officer Council has done over the last year and a half. Having joy rounds, celebrating successes, celebrating whatever is important to that team at that time. Spirit days. You might see a spirit day for the Olympics going on right now, or you may see a spirit day because it was National Cheesecake Day last week. Those types of things that really help gather some camaraderie and support of and recognition of the nurses. Some other things that they're working on is the balance for nurse leaders. Emphasizing that you have to take your time off, that you don't have to answer your emails at 9 o'clock at night. There's times that you have to take care of yourself. So in closing, there are many organizations that have implemented wellness programs, and we have to learn from each other. MD Anderson has a very inclusive, robust wellness program that has spanned from nurses to their medical staff and so forth. And so we have to learn from each other. And I think that that's really the takeaway, that, we've got to get better at sharing our experiences, partnering with some of our policymakers so that we're able to also have the funding and support to move these programs forward. Thank you.
Thank you so much, Dr. Tiazzi and Dr. Stamps. That was fantastic. A lot of what our audience is asking for strategies, but we're going to come back to all of that too. So our final speaker, Dr. Christine Pavico, the president-elect of the Metropolitan DC chapter of the Philippine Nurses Association of America, will discuss strategies that PNAA has undertaken toward individual approaches to addressing nurse well-being and health. And we're so glad to have you here today, Dr. Pavico, because we know that the Filipino nurses in this country have been very, very hard hit. So you were very specifically asked to come to this webinar today to really address what you're doing.
Great. Good afternoon, everyone, and thank you so much, for that introduction. introduction, Dr. Hasmiller, and for inviting me to be a part of this today. So, professional organizations also play an important role in safeguarding the well-being of our nurses. And I am here representing the Philippine Nurses Association of America, which has 55 chapters that support Filipino American nurses across the U.S. And Filipino nurses represent 28% of all immigrant nurses and 5% of the nursing workforce. And since we do have limited time today, I'm only going to highlight some of the things that we offer that contributes to member well-being. We provide educational programs, both webinars and conferences. And during those events, we are big on awards and meaningful recognition. We have mentorship and also a leadership development program called ILDP that I actually am a proud graduate and now serve as one of the faculty. And then we do tons of community outreach. We participate in medical missions, in vaccination clinics, food pantries, etc. And we influence policy, especially recently, those that are not only important, but also personally meaningful to us, like policies that promote diversity, equity, and inclusion. And then, of course, when COVID hit, we added many other initiatives to support nurses. And one of the initiatives developed by PNAA is the Heal Our Nurses Kabalikat program. And balikat means shoulder in Tagalog. So the program's goal is to create support, or in literal terms, a shoulder for Filipino nurses to lean on. And developing this was critical, especially as we began to see statistics of how Filipino nurses were being disproportionately impacted by the pandemic. As I mentioned earlier, Filipinos only make up 4 to 5% of the nursing workforce, yet the data being reported showed that 30% of fallen nurses in the US were Filipinos. So we knew deep down how Filipino nurses and their families, even though they might have smiles on their faces, were suffering from the emotional toll of the pandemic. Next slide, please. And knowing this, our local chapter in Metro DC administered the emotions behind the mass survey in June of 2020. And because of the valuable information that we gained, the Kabalikat program expanded the survey later in the year to all chapters. And the survey was created with 3 goals in mind. We knew that nurses were all feeling a mixture of emotions behind their masks. So we wanted to, first of all, identify and also begin the much needed dialogue about those emotions. Filipinos don't typically share about their challenges, and we like to focus on the positive. So sending the message that it's okay not to be okay, we felt was extremely important. And then second, we asked our members what activities they've already tried and found to be helpful in improving their well-being. This was important so we can offer tried and effective strategies to the rest of our members. And then finally, we knew that as an association, we wanted to offer additional resources for our members, but we didn't want to make the usual mistake of offering multiple things that end up being underutilized. So our third goal was to identify other activities that we weren't offering yet that our members said they would be interested in engaging with. Next slide, please. So when we analyzed the results, we were actually glad to see that many opened up about their emotions. When we asked, which emotion best defined your overall status, we found that majority were unable to stop worrying. They were angry and also felt isolated. And when we probed a bit deeper about their anxiety, we found that more than half said that their biggest worry was, first and foremost, keeping their family safe. And then, even though they're the ones at the front line, their concern for their own safety came second. And, I don't think any of us are surprised by that, because this is very typical of nurses. We always tend to put, others first. And then they also shared that the rapidly changing and just the overwhelming amount of information that they were getting also added to their anxiety. So our association quickly responded to this and invited experts from ANA and offered webinars to provide credible, essential, and current information. And more important, what we did was to provide a place where they can be with people that they felt safe with, and fellowmen that they trusted to ask questions. And this was particularly important, especially when we address vaccine hesitation. As many of you are probably aware, the survey conducted by ANF did show that hesitation was higher in people of color. So we wanted to make sure that we provided culturally sensitive and congruent information and invited Filipino nurses that are like them to share their lived experience with the vaccine and have experts on hand to answer their questions. And from this webinar, we were able to find out what their fears were and, effectively address those fears for them. I do want to point out that not all had negative emotions, since some did say that overall they felt confident about their ability to handle things, and some said that they felt good that they were making a difference. And then, the question about effective coping mechanism, that revealed that nurses found prayer groups to be effective in reducing their anxiety. And again, this was something that was not surprising to us because most Filipinos lean a lot on their faith to get them through difficult times. And because of this, several chapters, including ours, started to have nightly prayer meetings, at the onset of the pandemic. And I think the initial thought was, we're going to offer this for a short period of time. But, many of the members did verbalize that they found it to be very comforting and healing that we have kept it going even up to now. Then respondents also shared that staying socially connected with family and friends and enjoying, different forms of entertainment, such as reading, watching movies, or listening to music were also helpful. And then finally, we asked the question about what initiatives they were willing to engage in if it was offered by our association. And you can see the top 3 things that emerged are on the slide. Next slide, please. So number 1 was engagement in outreach activities and charitable work. So we made sure that we provided opportunities for our members to get involved in. And our local chapter, PNA MDC, did the Mass for the Homeless program. And in a short period of time, the group successfully provided masks to almost 50 homeless shelters, police stations, schools, nursing homes, and rehab centers in Virginia, Maryland, and DC. And, we know from studies that when we engage in something that brings purpose outside of work, it can be very helpful in improving our well-being. And that's exactly what we saw. I can confidently speak for my fellow members that for everyone who participated, whether it be donation, by money, supplies, sewing the mask, or dropping them off at the different sites, that it definitely made them feel good knowing that they were making a difference. And, this is just one of the examples of some of the community outreach that we did. And the next, they said that they were willing to engage in virtual workout. This one we weren't expecting. But, because of that, we offered virtual Caliente workout and everyone loved it. However, we did get feedback from some that they said they found it to be too intense. So as you can see on the slide, the second one that we offered was, one of lesser intensity, and we offered the Polynesian dance, which was a hit for all age groups. And then finally, we heard that they would be willing to engage in fellowships or peer-to-peer support groups with other Filipino nurses. And the picture that you're seeing on the bottom left of the screen is from the recent training many of us volunteer facilitators from different chapters participated in. And during the training, the volunteers started sharing their own experience just so everyone can practice facilitating the discussions. And I can tell you that by the end of the hour, there were a lot of tears shed. Everyone was surprised how much emotions they've been holding in. And, it was a beautiful moment for all of us to be there for each other. And we realized at that moment how much this support group is needed and how having a safe place to share our stories is exactly what is needed in order for our nation to begin the healing process. And because of that, we are now more passionate than ever to offer this to our members. Again, thank you so much for the opportunity to share.
Thank you, Dr. Pabico. That was wonderful. Lots of strategies. I think that many of our speakers have been providing a number of strategies. But I'm going to ask everyone to come back, all the panelists to come back. So thank you. And the questions have been coming in. I'm gonna sort of sort through the questions and determine who might answer. But this is for all of you to begin with. Let's warm up the panel, and I encourage, as we continue to talk about strategies and what's working, I encourage the audience to also put in the chat room what's really working for you. I know that I was talking to somebody yesterday, a company that had a wonderful program on mindfulness, and they said they were going to put their program in the chat function. So let's all do that for one another. But I want to ask you, both at the individual and system levels, I'm trying to condense some of these questions that have come in. At both the individual and system level, what's really working? And, the National Academy of Medicine, we're all about evidence. So what's really working? Is it one thing? Is it a potpourri of things? And then I'm going to ask you to back up with data. How do you know what you're going to tell me is working? How are you measuring that? And then we'll get to some other questions around engagement and how you're really measuring that. And the outcomes. So I will just open it up to the panel. You just raise your hand and go for it.
For us at Rochester Regional Health, it's really looking at, for instance, excuse me, our diversity, equity, inclusion training and education. So how many people are participating? How many people come back to the next series or complete the series? And so we're tracking that. We have close to, of our 20,000, and we started this training probably at the end of the spring. We have just over 1,000 members of our team, both from the physician level, members of our board, and so forth, that have had this education. And we continue to have a number of sessions scheduled out through the rest of the year. So that's one way we're measuring participation. And then we're also looking at patient experience, for instance. Or team member experience. Are there concerns or complaints that are raised around health equity or inclusion, and how are we addressing those and managing those, and hopefully putting in strategies to mitigate those for future as well.
Okay, others?
So this is Katie. I'll say this, and it's not necessarily going to be reassuring of an answer because it's a nebulous one. I learned from someone that was very wise during my time coming up as a nurse leader, and she always told me constantly, and it's something that's been ingrained in me, that a nurse is as good as their last shift. So we tend to do these point in time measurements, and we have to get to a point where we're understanding how nurses are faring on a day-to-day basis, on a shift-by-shift basis. And one of the most innovative things that I saw in my travels, and this was in Abu Dhabi, and this is an organization that actually just got their first pathway designated hospital, is that they have a very rudimentary process to measure how nurses are feeling every shift. And it's dots on the board, colors, by shift, green if you're good, red if you're not feeling so good, and yellow if you're not feeling so good, and red if it's bad. And they made sure that there were those indicators that were put on the board when they came on, because they wanted to know nurses' state of being when they came on for their shift and how they felt afterwards. And there was a requirement for that to roll up all the way up to the C-suite every day so they can understand how nurses are faring. I think that's a level of granular detail we have to get to, because honestly, we don't know how these programs are faring. We don't know how they're doing. Whenever we do engagement surveys, it's always very point in time, where by the time you get it, it's 3 months later, and it's hard to do an action plan based on that. So I think that's where we have work to do.
Okay. Yeah. Vicki, go ahead.
Yeah, That's perfect, Katie, because I was going to head down a very similar path. I think the trick here is that there are no quick fixes to well-being. And I think a lot of times we find in organizations, they're looking at it with a problem-solving lens, right? That well-being is something to be solved. And here's the thing that we're going to put in place that will solve it. But truly, when you look at well-being, this is something that needs to be managed over time, right? Always. It's not new and it's not going to go away. So I think the trick is, and I really love that example, Katie, that it's something that has to be baked into our processes and our practice and the work that we do as nurses. And I think really thinking about that differently might help. I would say, in addition to that, one thing that occurs in my organization is a lot of listening sessions. So it's really listening and understanding and not assuming that, okay, here's how we're going to fix it. Let's put this in place. But really beginning with that first step of listening and understanding can really go a long way.
Great. So Marcus, I'd love to get your perspective. You were on the committee, but you're also a frontline nurse at this moment. So what's going on in the front lines where you work, and what's kind of working for you and your peers?
I was sitting here thinking, you said, we need examples of programs. How are you measuring? And from my experience, I'm lucky if I get asked some days how I'm feeling and how I'm doing. Mm-hmm. So when you ask about what programs and outcomes and how we can measure, I don't even think we're there yet, because there are people that avoid the question. When you work in a constant environment of uncertainty, of staffing shortages, of experiencing verbal or sometimes physical abuse from patients, it seems as though it's almost the blame of, well, what did you do wrong and how can we prevent that? It's not, how am I feeling after this incident? How can I support you to make sure that when you come back to work, you're not scared or stressed or fearful of something that might happen when you're working in certain conditions? It always goes to that reactionary piece to what Vicki was saying. So, I struggle because I don't, and I'm an educator, and I always do pulse checks with my students. I stop. How are you feeling? How are you doing? Because I wasn't always asked that. So I try to instill that, at least from that peer-to-peer level of doing those check-ins. The first question isn't getting right down to business in who you're talking to. It's, how are you today? How are you feeling? What has happened to you? So taking that trauma-informed approach as we speak to anyone is really what was going through my mind.
That's fantastic, Marcus. And it seems like that starts at the top, right? A chief nursing officer, a nurse manager, to set that tone for, a culture of compassion, if you will. So speaking of, let's stay on that tack a minute, trauma-informed care. That was one of the questions. So how might we incorporate that? Or do you know examples of programs or institutions that really are taking stock and of trauma-informed care and how they're bringing that into their programming? So Debbie, you're shaking your head yes. Take yourself off mute. There you go.
Yeah, we actually do this multiple pronged approach. We actually have opportunities within the school, the college, where we are not only educating, but also providing an opportunity for our students, for instance, to be able to work with a counselor, to be able to work with their advisors, and bring and share those experiences, and then we connect them to resources. The wraparound services that are needed today are just enormous. And so that's our students actually in their first few weeks actually share, why did they choose to become a nurse? And their stories are just, they bring tears to your eyes. And, that's another way that we identify that there may be trauma that they don't even realize has happened to them. And so it allows us to have our counselors and advisors reach out to them and connect them with resources. We're seeing that need a lot more.
Yeah. So Marcus, you said where you work, it would be nice if folks would ask each other how they were. It struck me as we took the committee, and I love doing this, we took the committee on some site visits, remember that, around the country to look at best practices. And I remember we went to Philadelphia, or I should say New Jersey, to the Camden Coalition. And it was really about caring for people in the community who had enormous challenges with social determinants. And I remember the head of the Camden Coalition saying, we don't wait to ask our nurses or our providers if they've been traumatized in any way. We do huddles every day, and we just assume that everyone has issues in their lives, and we come together and we check out how we're feeling with each other, because nurses cannot give what they don't have. So I was just really struck. Don't worry about asking about, trauma, just assume and do what Marcus, you said would be very helpful to you. So Christine, I'm going to ask you something. A question came in, and you touched on this ever so briefly. So why don't you get us started, and we'll see what everybody else thinks. But the question is, would you please talk to the intersection of spiritual and religious beliefs and practices as they intersect with nurse coping and well-being? And how do you think these approaches help or hinder getting nurses more involved?
Thank you, Sue. So, I really do think that spirituality and well-being go hand in hand. Because, if you look, even at the definition of well-being, it's the state of our body, mind, and spirit being in balance. So if you think about, that spirituality, can really immensely impact our well-being. And, I've even read that believing in a higher power, looking out for us can be comforting, especially when we know that, some of the things are outside of our control. And sometimes, even just some of the things that we do make a difference. The simple act of prayer alone is powerful because it gives us a feeling of hope, especially during difficult times. And then when you do it as a group, I think, that even provides added comfort. And this is, the reason why having prayer groups has been so effective. We do feel stronger when we unite and, we pray for a common cause. And, with our prayer groups, I think one of the things that, I know you asked earlier about how do you measure success, some of the things, really, you can't even measure by numbers, but, for us, we look at the engagement. For the prayer groups, it's something that they have even verbalized and said, this is very healing and comforting to us. And the fact that, we see members continuing to attend every single night, is very telling to us that, that's something that is very effective for them and is really helpful to their well-being.
Yeah. So I think we can all agree, audience members, panelists can all agree that these strategies are important. We're trying to get a handle on best practices and where the evidence is. I want to turn our attention now to the students, and to the faculty. So what do you think should be done? I know when I was in nursing school, it was just considered, look, you're just lucky to be here, and get on with your job and the tasks at hand and being a nurse. And there wasn't a lot of attention. Excuse me, there was no attention to my well-being. So what do you think that nursing educators and nursing schools should do to address this issue? Who wants to start? Okay, Marcus, go ahead. And go ahead and take yourself off mute too. Yeah, you want to jump in, anybody? Go ahead.
Yeah, happy to jump in because it's something I thought about when I saw that question come through. And for me, it's the accountability piece. So first, we need to take that assessment of what is the well-being of our students to make action. So, I think about accreditation standards. So how are accrediting bodies ensuring that we're focusing on the well-being of our students, the future workforce, and measuring that? So then when there are issues that arise in the data you're collecting and measuring, how is a school going to respond? So I think there's onus on accrediting bodies to ensure that it's a focus. And I think another point, much like the entire report, we're talking about social needs, social determinants of health and health equity, and how it can no longer be relegated to one course. And that's well-being as well. It has to be integrated throughout. So when we think about the fundamentals course, everybody takes that intro to nursing. That's where you begin the conversation. And then in every course thereafter, continue that conversation about self-care and well-being. You know, at the University of Pennsylvania, we provide on our syllabi the mental health resources that are available to students. Is that a standard of practice across all schools? Making sure that it's up front on your course management systems and in your course materials, that there are places that you can access. And I think for ourselves as educators, normalizing it. I mean, I can't sit here, you know, I tell my students, I've experienced anxiety, I've been depressed. So normalizing the conversation so they don't think that we are all these perfect people, because we're workaholics and we have to model the behavior of taking care of ourselves. And I think that's how we reinforce it for our students.
Okay. Debbie, you're in the field of education.
Yes, I agree a lot with what Marcus shared today. In addition, it really is about accountability of the leadership of the nursing programs. You know, we have to set the expectation, and then we have to provide the resources. And so whether that's through education and training of the faculty so that they're equipped, and it's also providing the supports for the faculty because many of them have experienced trauma. And so, you know, how are we supporting them to be able to support students as well? And then having the resources, you know, having the resources on your student management system, but also being able to have those community resources and connections where you can refer students to, whether it's, you know, for food or for additional finances. So I think that it's multifaceted. It's going to take investment. And it's going to take us becoming comfortable with some of the traumas that students and faculty have experienced, and ensuring that we have the resources for them. That's going to be key.
Okay, others at all?
Yeah, and I'll add this. I do think there's a culture change and shift that has to happen in that setting. And when we did our listening sessions, pertaining to the Commission on Racism, when you peel back a lot of the history around the stories, particularly for nurses of color, it starts in that setting. And we have to be mindful also that some of the harm is being inflicted by some of those faculty. We need a more diverse faculty in nursing. I believe the last data I saw, nursing faculty is 85% white. And there needs to be an understanding and grace towards all cultures, not just the people that we care for, but the people that provide the care. So that's where we also then move towards understanding that self-care should be part of the curriculum. We have to move away from this no crying in baseball thinking with getting through nursing school, right? The nursing school is set up to toughen you through to make it on the other side. And if you don't make it, even if it's not because of your grades, you're not tough enough. So maybe you're not nursing quality, right? So that's part of what we need to change in that setting, that culture that also extends to the work, right? You know, where you have to be tough, you can't cry, you can't feel, and if you can't cut it, maybe this work is not cut out for you. We have to move away from
I think just to piggy on that, just one more thing is that, you know, nursing has had a long history of horizontal violence, right? And bullying, and we have to change the narrative on that as well. And that does start a lot of times in nursing school and goes into the work environment. And so we do have to change that narrative. And again, I think that goes back to leadership, you know, setting the tone, setting the expectation that our program is not going to be that program. Our program is going to be the one that embraces everyone and helps students be successful. And you know, it's a contract. When we select them to come in, we owe them everything as long as they work with us to be successful and be able to complete the program and pass their boards and so forth. So definitely that horizontal violence plays a role too.
And I
Okay.
just want to, add also to what Katie said, because, I do agree that I think, it starts in school that we need to teach students, about our duty to self. Because, in fact, that's in our code of ethics, right? But if you ask nurses, how many of them even know that? And, most of the time it's not something that, we really give importance to. And, I say that because, only we can make the time sometimes. And, one of the things that's very disappointing, when I talk to CNOs from different organizations, they are so excited to share all these things that they're offering to nurses. And then they follow it with, but nobody's taking advantage of it. So, I think we also need to emphasize to nurses individually that, as individuals, they have a duty to themselves.
Okay, so I have a very big question here. We have about 10 minutes left, and I've tried to sort of bunch these questions together. So at the meeting before before I came to you all this afternoon, there was a Hill political consultant, and he was giving some, comments about what was happening on Capitol Hill. And he happened to make the comment that never before in his history of working on the Hill, and he's worked there for decades, has he seen an administration who really cares so deeply about the workforce in this country, and particularly the health professions workforce. As we all know, there's a lot of money that's been put on the table, and probably more money to come. So for those people who may be in the federal government or other programmatic folks who are listening in, or President Biden, what would you tell? Let's do that. What would you tell President Biden about where the money should be spent in terms of nurse well-being? Lots of money. Where should the priorities be in spending money on nurse well-being? And be as specific as you can. And it's a big question. So I will take anybody who wants to jump in. So it looks like we have Katie jumping in.
Yeah, I will. I think the one way to start is that we need a national task force. I think there's enough data that indicates that this is the direction that we need to go. We need a national task force to work on tools to get us to a point where we're constantly assessing and acting on what we see and preventing issues that causes nurses to leave the profession, or worse than that, commit suicide. I saw a question about suicide prevention. So I think there's enough in the data. And with what we've endured with the pandemic, that's been a protracted trauma. I think now is more of a better time than any for us to have a national task force on this issue. We've seen enough. Too many families have been impacted. Too many lives have been impacted. The workforce itself is so unstable. There's a lot of data that proves that this is the direction that we need to go to at a high level. So I'll start there, but
Okay. So would you like to name a couple of people or not people, but organizations that should be involved in this task force?
Well, for one, of course, I'm going to say Healthy Nurse, Healthy Nation. I'm going to say the Wellbeing Initiative, but I also believe a lot of our multi-ethnic associations, Christine's organization, should be at the table too, because that all plays a factor. We should also have organizations that address nurses that practice in all settings, because not all nurses practice in hospitals. And people are suffering in the academic setting and faculty. So we have to have representatives from organizations in multiple areas where nurses practice. So, but I'll start with the ones that I'm involved in.
Okay, that's great. Okay, no surprises there. No surprises there. Okay, other recommendations for President Biden? Are you listening, President Biden? Okay. Go ahead, Vicki.
Sure, I will jump in. So getting back to the idea of the documentation burden of nurses and the amount of that is regulatory and administrative in nature, there was a terrific initiative that took place earlier this year that was sponsored by the National Academy of Medicine. And it was a symposium to reducing documentation burden for U.S. clinicians by 75% by 2025. And it was coordinated by Columbia and Vanderbilt universities. As part of that work, there were a number of initiatives that came out, looking at quality reporting, some of the regulatory burden connected to documentation. And I think putting some funding behind that work could be very beneficial, because if we can create more time and more space for nurses to have those relationships with patients and families, connect with their coworkers, I think that could make a big difference.
Okay, great. Okay. President Biden is listening. Others?
I just want to add, Sue, I think we can just, assume about the prevalence, but, don't know exactly how much PTSD, we're going to be seeing in nurses. So I think, proactively identifying that and also having programs in place to support the nurses.
Okay. Okay.
And, I think for me, I don't know how specific this is, but my brain is thinking about social needs. A lot of this report talks about the social needs of our patients, but we ourselves as nurses have social needs and are impacted by social determinants of health. So for me, it's thinking about what resources can be put behind housing needs for nurses. I mean, the American Nurses Foundation supported a lot of grant funding for nurses that were experiencing financial distress because of the COVID-19 pandemic. So looking at the data from there and what is the financial need of nurses, thinking about paid leave for nurses that need that expended time to care for their family or care for sick loved ones. So just thinking about all of those other broader social needs that we ourselves experience, the traumas that we experience in our own lives. And we saw that throughout the entire pandemic of nurses needing to maintain their work to provide for their family members who lost jobs. And they were the essential workers. So I think thinking about those types of programs across all sectors and spectrums, much like we're talking about investing in infrastructure, across the board.
Okay. Debbie?
I think being able to have an infrastructure around data from an employer perspective, academic perspective, at all levels, looking at where are our nurses, they complete school, they complete their boards, they, where are they working, where, what's the turnover that looks at, what's the turnover look like? And I think that all looks at, ensuring that we have outcomes that we can hold organizations accountable to.
Okay, that's great. So we're about to adjourn, and I want to ask one more sort of, I call it a popcorn question, and we'll just be really quick. We have a large listening audience. We've talked a lot about strategies, education, policies, funding. What's the one thing, and we've all been in this together, nurses and other healthcare providers. It's been a really rough road with COVID, but this report really comes at such a great time, I think, with all the racial injustices that have gone on and the disparities that have been laid bare with COVID. So unfortunately or fortunately, the report has come at a very good time. So what's the one thing that you want to leave this audience with? What comes to your heart, your mind? What's the one thing you'd like to leave the audience with? Can be anything.
Yeah, I'll start too. I think one key thing is for nurses to not shy away from dealing with social issues and being at the front of social issues. Nursing was founded. A lot of our history is rooted in being front and center with social issues. Now more than ever, these issues require nurses to step up. And until we deal with these issues, we cannot properly address social determinants of health. The road runs straight through us dealing with understanding that we have a role, understanding that we have an issue in our profession, and then we can appropriately and effectively deal with health inequities and social determinants of health.
Great. Okay, I'm inspired. Marcus.
For me, it's to recognize that we're all human beings. So recognize our common humanity and treat each other as such. We don't see that. So bringing it back to that, human caring, I think is the message I would leave the group with.
Wow, this is fantastic. Christine.
Yeah, and for me, Sue, I think sometimes we don't know what we need until, we're there. I mean, we saw that in the peer-to-peer group, training for the facilitators. So, I would just recommend everyone, not to be afraid to try things. And you also heard from many of the speakers today how healthcare organizations and us, professional associations are making so many great resources available. So I just want to say, please take the time to utilize them because we are investing in you. So we just want to make sure that everybody else is investing in themselves as well.
Okay, Vicki, bring it up.
So I would say as nurse leaders, nurses just continue to lift each other up. I think nurses are in such a unique position right now. We are seen, we are heard. And if we can really serve as role models for the rest of society, that would be a great thing.
Well, I will tell you, you have all been fantastic and you have inspired me at the end of these comments. So thank you so much for participating. And a big thank you to all of you and to all who joined us today. We're offering CEUs through the National League for Nursing. This webinar will count towards 1 contact hour. The survey link will be sent in an email following this webinar. I'm not going to say what that link is. You'll see that. The slides from this webinar will be available on the National Academy of Medicine website, where you can access a link on this slide. And that slide should be up now. You can complete the quiz and earn your CEUs. The quiz will be available until August 30th. The attendance verification code, also on the slide, is 804. Thank you again to our participants, and thank you for joining us and for submitting your comments and questions. We'll have one more webinar this summer that you can register for on the National Academy of Medicine website. That'll be on August 11th, and that'll be on diversifying the nursing workforce. So goodbye, everyone, and let's do what some of our panelists said to do, continue to care for each other. Thank you so much.